So you received help from school, or you looked for it yourself? Like you had to see a therapist?
We had an employee assistance program, which was available in our district. So they gave us a list. I provided my address, and they said that, oh, these therapists in your area are, they waived the copay for us, which was nice. So like when I go to see a therapist, like I don't have to pay the copay for it.
Mm-hmm.
So they're helping out our school, but there were a lot of people on the list, and I was just like, oh, that address sounds good. And they have a psychiatrist and a therapist in the office. So I was able to go see one and then the other. But I ended up not going to see this psychiatrist anymore. I just go to the therapist. And I've been with her for 2 years now, and she's great.
Nice. So what are there any specific strategies that you know that have helped you the most?
There's strategies that I use when I'm having like a PTSD moment, and that would just be grounding. And the grounding technique is you name in your head like 5 things you smell around you, and it changes. Like it doesn't have to be 5 things you smell, it could be 5 things you see. It's just like 5, 4, 3, 2, 1. So I name things that I see, I name things that I hear, I name things that I smell. And that's more for people that like are put back into that visual arena. Like some people, some teachers that I was with, when they would have a panic attack, would be right back in their classroom in their head. And that grounding is useful for that, to be like, I'm not actually in my classroom.
Like having awareness of your environment and your senses.
So it's helpful for them. For me, it's just like a distraction. It's like taking my mind off it. That's all it is. I think therapy is very useful, just like the talking part of it. And I've always been interested in like psychology stuff. So I'm always like, oh, I wonder if I did this because of this. Like I'm trying to psychoanalyze myself all the time. But it's more like what things aren't helpful. I was just listening to a speech podcast the other day, and they were talking about the bad coping strategies. So there's people that turn to alcohol, there's people that turn to drugs, there's people that turn to isolation, TV. Like there's bad coping strategies. So it's all about knowing that. And I would definitely be a person that isolates. I would rather be alone, and that's not helpful. So it's all about knowing and talking about what you're doing, what your brain is thinking of in that moment, and being able to say, like, this isn't healthy for me. I'm going to go for a more productive or helpful coping strategy.
Nice. It's good that you're aware, and even when you see that you're going the wrong way, you can put yourself back on the right path.
Yes.
Do you have patients with PTSD or patients that got like a speech impairment after a trauma or stress? Like, have you worked with those kinds of people because of your experience?
I work with my students at this school who most of them have some sort of PTSD from that. Some have been diagnosed, most haven't. But I just treat all of them as though they have some sort of trigger for something. The adults in the nursing home that I work with, I don't get any PTSD that I know of. But I would like to work more. When I was in grad school, I worked at a aphasia clinic, and my supervisor who ran the clinic said that I would be really good with veterans, and they wanted me to work at the veteran hospital here, like a large VA system. And And I would have loved doing that. I bartended all through undergrad and grad school, so I can work with those the types of customers, you know. But I would like to work with veterans more that have brain injury or PTSD, because I think I can relate to it. And I've actually spoken to a lot of military people here that have been through, you know, whatever overseas or just PTSD in general. And they're like, I have a different connection with you. Like, I trust you, or I understand what you've been going through, or I feel a connection to you because of that you've gone through something so terrible. Like, it's weird that I can relate to people that have been through war. I don't want to relate to them, you know? But they tell me that, like, I trust you more because you handle yourself a certain way after going through trauma, and a lot of people don't get the support that they need, especially like the veterans. We hear about it all the time. So I would like to work with veterans eventually.
Nice. I kind of had, it was actually my first case when I was in my clinical practice. And it was a girl in my age at that point, when she had lost her voice after a car crash. And I was, in the end, she was talking. I was really proud of it. But it was really interesting how you see that. I think everything was in her head. We were working very close with the psychologist, and it was very interesting to see the progression and how she got better in the end, and everything was getting better, like her memory, because she had also kind of memory loss, and her situation, like emotionally, and in the end everything was perfect. And
I have memory loss from my situation. So my whole life I've been told I've got an amazing memory. I used to remember like people, names. I'm very good at trivia, like for fun. And after that happened, I couldn't remember a lot of things. The 2 months after that, I don't remember a lot of like, oh, I went to this place, I went to go see this movie. I don't remember seeing certain movies that I saw during that time. And even now I struggle a little bit with like lists when someone verbally tells me, go take out the trash, go get the mail, go do this, go do this. I cannot remember that. So I have to use these strategies like I use for my patients at the nursing home, like visual aids to help me, because otherwise I can't remember things like that like I used to. And the therapist said that this is part of PTSD, and there are a lot of staff and students at my school that did EMDR therapy, and that's like rapid eye movement kind of therapy that's supposed to bring back some memories or open up I haven't done this. I would like to go see a therapist that specializes in that. I just haven't. I've been procrastinating, and it seems daunting to make another appointment. But I would like to try that, and I know it's been very effective for a lot of people at our school for getting back certain memories, or looking into some things that they've purposefully pushed back into their mind.
But the memory loss starts from the incident, or you also forgot some stuff from before?
A little bit of both, but mostly after. I feel like my long-term memory recall isn't as great. So especially with movies, I used to be able to say like, oh yeah, I saw that movie, and like play it out in my mind. And now I'll be like, can't really remember what happened in that movie. And that was when I first started noticing it, was through movies and TV, that I was like, I can't remember if I saw that. And that I was like, that was scary to me when I went to my therapist. I was like, I can't remember things. And I was told it was a side effect of trauma.
Yeah. I think sometimes the brain is trying to protect us by erasing some stuff that it's bad to remember.
Yeah.
Yeah.
There's just gaps in my memory, which some of it comes back. I think recently it's been coming back. But it's been a while, and it gets very frustrating because I used to be someone that, like, you would ask a question and I'd be able to say like that weird answer, and I couldn't answer a lot of things. So it is a scary feeling to not be able to access your memories or seeing a change in what you were able to do.
Yeah, I cannot imagine, like, because we see it also in our profession, people that lose memory progressively, and it's really easy for us to get triggered, like, why did I forget that? Like, you start thinking of other things, and it's not good. Do you think that therapy, like seeking therapy, is a taboo in our days? Like,
Yes, I think it is, but I think that there's been so much progress in trying to make sure it's not a taboo, and especially culturally. I had a class in grad school about cultural differences. I can't think of what the name of the course was, but it was about cultural differences everywhere, and what expected behaviors or like taboos were. So I have a lot of students that their parents, depending on the culture, are like, no, we don't go to therapists. We deal with it. And even some people that it's not the culture saying no, it's the parents or the family unit saying no, we deal with stuff in our house and we're going to deal with it. Or I definitely think that there is still a taboo, but it's, even if you look on Facebook, there are so many Facebook and Instagram, so many accounts dedicated to mental health awareness and outreach, and I think they're doing a good job about it, but it still is a taboo. I mean, my grandpa lives close to the school. I used to see him a couple days a week when I would leave school. He's 92. And when I said I would go to therapy, he was like whispering it to me. He was like, you go to therapy? I was like, yeah, like screaming it, like, I go to therapy. And he was just like,
why are you crazy? Like, yeah, because
that's kind of what he thought of it, was like, how bad are you that you're going to therapy? And it's like, it doesn't matter how bad. I am the biggest proponent of going to therapy before there is a problem. Like, you want to have it in case things get bad, because I know now, like with the quarantine stuff, people are really feeling anxious and depressed about this. And if you had a therapist set up before this, it would be much easier to get an appointment and handle this with someone that knows you. I am a big fan of everyone going to therapy, no matter if you think there's problems or not.
Yeah, definitely. I agree. It's nothing to be ashamed of. It's you're taking care of yourself. The same way you will say I went to a spa and be proud of it, you should say, yeah, I went to therapy because I
Right.
need it. I feel like I need it and I did it, and I shouldn't be afraid to say it or ashamed.
Yep. I agree with you completely. And one of the things that I would do when I was at school right after, and I would make sure to, like, for kids I knew that were struggling, I would be like, oh, I went to therapy. Like, I would say it. And some of them would be like, you went to therapy? Like, I think a lot of them just don't know people that go to therapy, or adults that kind of say it. So I just wanted to put it out there. Like, I go to therapy. I didn't say like, oh, I go and talk about this, but I just wanted it to be like, they know someone who does go.
Yeah.
And that's all I wanted to make sure, that they knew that an adult that they trust, that they know is doing it and is continuing to make appointments, even though that there might not be an issue at the moment. But I think a lot of people, the students at my school that initially did not go to therapy, have since gone. In the 2 years since it's happened, I think finally we're like, oh, I'm ready to talk to someone, or their parents were like, we have to do something and everything else hasn't been working. And it's been, our school is very aware of mental health, I think, now more than ever.
Now, yeah.
Yeah, now.
Yeah, I think it's also the way that media is showing people that go to therapy. They're always like the extreme cases, also in movies and series. So in everyone's brain, the people who go in therapy are, well, borderline crazy. So
Yeah.
everybody thinks like that. So when you say to someone that knows you, yeah, I'm going to therapy, it's like, oh, it's the same person that was still before knowing that she goes on therapy. So
yeah, it's important.
Yeah.
I'm trying to think of a movie recently, but like I think of Ace Ventura. I don't know if you ever saw that movie with Jim Carrey. He's like at the mental hospital in a tutu and running around. And I think that's what people think of, like mental issues, is like people acting weird compared to what they are doing. And it's not, it's two regular people that are going and having a conversation about things, you know, and it needs to be talked about more in the media in a normal
way, like from real people.
Yeah, having an extremely boring conversation, because that's what mine are.
It's not boring. I'm having fun.
No. In therapy, like me talking to my therapist, and I'm like, she probably is so bored right now because nothing is happening. But like, that's all it can be, or all it needs to be. You don't need to have some big issue going into therapy that the therapist needs to pick apart and help you with. It could just be continuing the relationship so they know more about you. That's all it has to be.
Exactly. It doesn't even have to be a therapist, as long as you talk to someone you trust. Either it can be like a family member or a close friend. The beginning of everything in dealing with your emotions is to start talking, because also a lot of people don't talk, like especially men. They would feel like, hey, yeah, I'm weak if I say that I'm scared or I have stress or whatever. So the first start, like talking, and then maybe therapist.
Right. The big thing that I have to say is I would prefer someone that is trained for it, because I would hate for someone to get like, you know, a dismissive answer. Like if you go to one of your aunts or uncles and they say, you'll be fine. Like,
that's not an answer.
You know, and I go off about that all the time, is these dismissive answers that like therapists are trained to handle how to continue the conversation in a productive way. And I'm always analyzing my therapist, like, ooh, that was a good one. Like that was a good response. And I try to bring those practices into how I speak with the kids, my students, during speech, not as a therapist, just as a way for me to validate their feelings and not be dismissive. I don't want to, if they have a hard day, I'm not going to tell them, no, they didn't. That's not for me to say. It's, I understand how you're feeling right now. It's a tough time that we're going through. And especially during this quarantine, I don't want to be like, everything's going to be fine, because it's not for everyone. You have to be realistic. And I work with high schoolers. I'm not going to tell a 5-year-old that we're all going to die. But I make sure to talk with my high schoolers. And if they're having concerns, I'm going to say, I understand how you feel that way. We are going through a tough time right now. How are you doing? Or like, can I help you in any way?
Exactly. The point of talking is to find someone, not to give you a solution, but to just to listen to you and understand you, because there are two types of bad answers. One is it will be fine, it's just a phase, and the second was like, no, I have a worse story. And then there's that was I'm like, I don't want to hear about your story. I want to talk about mine. And your story is not gonna make me feel better, maybe for a while, but I'm still going through it. So
Right. And that's important to people that don't have training, that are talking to kids, and it's like all this bad stuff. Like, it's great to talk to people, but also I say how much therapy helps, and I'm not going to be a person that's lying to them, like go to therapy and then I don't go myself, or like I'm not putting mental health first, which it is. And I tell my kids, like, it's okay to have bad days. It's okay to have a bad hour, or you can have like a bad 5 minutes. You just, coping strategies are the biggest things. Even when you can't go to a therapist, you can't just call up your therapist all the time saying like, I'm having a hard time. You need to be able to handle them within the moment. So the coping strategies have been the most effective thing for my students, because they can bring that to college with them. They can't bring me. I'm not coming to college wherever they're going, but
I
they
hate
can
that.
take their grounding techniques. They can take anything that they've learned with them to college and be able to cope there without an adult or a safety person.
Exactly. I have a last question, which is about what we're going through. How much do you think that all this, the quarantine and the media saying, yeah, don't go out, we're all gonna die and whatever, how much do you think this is going to affect the people after all this is over? How much it will leave a trauma?
I think we need to think of this whole quarantine and pandemic as a collective trauma. And for me to say I'm doing fine is okay, but for people to say this is not a big deal is not okay. Like, because it is a big deal for some people. I have my job. I'm lucky. I have one job that's paying right now, but there are many people out of work. There's many people, many families that are financially unstable right now. And um, we need to start thinking of this as a trauma. There will be repercussions after that, once we all get out of quarantine or whatever the decision ends up being. I know that they just canceled school for us for the rest of the year.
Oh,
So we were supposed to end June 5th, I think. They just canceled prom for us. So these are losses now. These are grief-worthy losses for our students to handle, and they're experiencing grief alone or at home. And it would have been helpful to have a therapist like during this time for a lot of them to discuss these feelings of loss. But we do need to consider that after coming out of all this, that it is a traumatic experience and people are going to handle it differently. So when we're all out of here and people are like, well, nothing changed for me, or well, that was all for nothing, or even the media. I work with kids that are obsessive, anxious, depressed. Like, many of them have problems like that, and then they're obsessive about the news and they're perseverating on it. I have some students with autism that are just like, we're all going to die. They're getting the wrong information because it's scary.
exactly on that. I was talking with my cousins. He has a son. He's I think he's 9 right now, and she was telling me that at the beginning, the way that everyone was talking about it, and the media, and they closed the schools, and they were saying that, yeah, don't go visit your grandparents because it's dangerous and maybe they will die. He was so scared. He didn't even want to talk to them on the phone, because he was
Yeah.
afraid they're gonna die. It's crazy what brainwashing they're doing in a wrong way. Like, not that
Yeah.
there's a good way of brainwashing, but I mean, come on.
I think it's hard because I wouldn't recommend having young people watching news like that. Like, I don't, when 9/11 happened here, I wasn't allowed to watch the news out of fear that I would become obsessive or worried about it. So I'm not sure. Like, the news is kind of for adults to handle that. They have the capability to understand it and take from it what they will. But I work with my students on context clues and understanding meaning from paragraphs. So when they're reading these articles and all they can see is like, we're all gonna die, like, it's not for them. So it's, as much as the media is putting out there these scary things, it is real life for a lot of adults. But I don't know if kids should be able to see this. I think that's where the obsession comes from, or the worry comes from.
Yeah,
So
true.
you just need to be careful about the access that kids are, all the kids at my school, I mean, they're between 14 and 19 for my high schoolers. They all have phones. They're all accessing whatever they want, but for the younger kids especially, you need to be aware. Parents need to be aware of what their kids are having access to.
Definitely. I think that's all I had to ask, actually. I don't know if you want to ask something, if you want to say something, like a message to the people.
I think therapy is great. I know it's not for everyone, but what you can do is coping strategies. You can look these up online. You can look for ways that'll help you. I know they gave us, we had people come to the school right after the trauma happened for us, and they're like, let's do these breathing strategies. And you could just see like the men in the room that are like, I'm not doing this. Like, I'm not learning how to breathe. And that's not for people, but it's helpful for me to like sit there and it's a distraction. It's not the breath work that is calming me, it's my mind and the counting. Like, I'm going to breathe in for 8 seconds and then hold it for 4 seconds, and that is more helpful just as a distraction. And
like meditation, you just empty, even for 10 minutes, if you just empty your brain, which is constantly running, even those 10 minutes are very beneficial.
So watch what your kids are having access to, because the new stuff, I saw it with what happened with our school. I have students that were getting Google notifications every time our school was mentioned online, which was millions of times. So they were getting these Google alerts like Marjorie Stoneman Douglas was, and it was obsessive. That's not, you can't obsess about these things. I don't watch the news. Like that, it's not healthy for me. I know what's going on, and I'm like paying attention to the mandates and stuff, but I know for my mental health, it's not helpful for me to watch 24-hour news cycle of sadness, because then I'll go into sadness. So it's more about knowing what triggers you, knowing how to get out of that, and just paying attention to your mental health and asking for help when you need it. Because asking for help was probably the hardest part for me, that I was like, no, I can do it all by myself. I don't need anyone. I don't need help. And then now I ask for help all the time. I'm like, please help me.
Please help.
Yes. So it's going to be a hard time when we get out of this, but we have to consider it as a trauma, as a traumatic experience, and something that we're all going through, but we're all not going through it the same way. So we need to be aware of that.
Exactly. Because it's not as easy as it is for me to stay in the house. Some families are not meant to be inside the house the whole day, like domestic violence and all that. There are a lot of bad parts in staying in the house.
Exactly. Or we're all online schooling. You have older students that are now online schooling their younger siblings, or there's one computer, or there's so many situations, infinite situations, and you can't know. So we can't say like, oh, these kids are having an easy time at home. We don't know that. We can't say that.
No. You never know.
No.
Okay, so thank you very much.
Thank you so much for having me.
Of course. Thanks for everyone who is going to watch this video. I hope we were helpful and you will take what Rachel said in consideration. Be strong, deal with your fears and your stress. Because we're all, exactly. Thank you very much again, and see you whether virtually or live next time. You never know. Thanks.
Yeah.
Ciao.
Bye.
Bye-bye.